In the 21st century, we've seen incredible advancements in healthcare, leading to a remarkable rise in life expectancy. Yet, this traditional model of investing always in high-tech medical solutions to manage disease progression will not be enough. This model will worsen social inequalities in our healthcare system. Instead, we must prevent diseases early by creating healthy environments for everyone. 10% of all deaths each year are due to environmental exposures. These deaths are preventable. So what can we do to change this? The biggest environmental threat we face is particulate matter. These tiny liquid or solid particles suspended in the air cause 7 million deaths every year, equivalent to the entire burden of death from the COVID-19 pandemic. In economic terms, this cost us 5% of the global GDP. Particulate matter can come from natural sources like wildfires and sea spray, or human activities like heating our homes and driving cars. How can something so small be so dangerous? Small particles we breathe can enter our lungs and bloodstream, causing chronic health problems like heart diseases, stroke, and respiratory issues. In 2021, the World Health Organization updated its air quality guidelines, setting a new, stricter limit for particulate matter, 5 microgram per cubic meter. Today, over 99% of the world population lives in areas that exceed this limit. Western countries in Europe and Northern America, for example, have progressed towards the former limit of 10 microgram per cubic meter. But levels above 50 microgram per cubic meter are still common in developing countries like China or India. Reducing our reliance on fossil fuels and cutting down residential emissions will undoubtedly help in polluted environments. But what about cleaner environments where natural sources like dust and wildfires are a problem? Even if we eliminate all human emissions, half of the world's population will still live above the new guidelines. How can we meet these standards when natural sources are destined to increase with climate change? Right now, particulate matter is regulated as a uniform entity, based on its total amount in the air. But not all particulate matter is equally harmful. Its health effects depend on its chemical composition. Think about it. Breathing salty sea air on a summer day is very different from inhaling soot from an old truck. So how can we improve our guidelines to consider the toxicity of different chemical components? For this, we need global data on particle chemical composition to identify the most harmful components and their sources. In this direction, we at PSI initiated the development of detailed exposure models, the gathering of long-term data on PM composition, the mapping of pollution hotspots with mobile measurements, and studies of how emissions change in the atmosphere. In collaboration with health scientists, we are working with citizens to understand the impact of particle chemistry on their health. This is simply the first step for considering the chemistry of particulate matter in guidelines. Imagine a future where everyone has access to clean air. High-resolution global atmospheric data can make this a reality. This data can transform how we manage our environment, raise public awareness, and empower smart policy making. It can affect individual behaviors the same way health apps encourage exercise. With detailed information, we can optimize strategies to reduce the most harmful PM components, predict future pollution trends, and create healthy, sustainable, and resilient communities. Achieving this requires collaboration. Scientists, policymakers, and the public must work together to re-evaluate air quality guidelines and prioritize environmental health.